now tell your goals.
So my main focus is my upper lip, just kind of making it more even with the upper and lower.
And a little more definition.
Yeah.
Okay. All right, so we're using Juvederm. Juvederm is my favorite product for the lips. It lasts a good year. Sydney's been numbing for a good 15 minutes or so. I use a topical numbing cream, which definitely takes the edge off, makes it much more comfortable. We are using Juvederm, like I said, my favorite lip product, especially for younger women who want to see a little bit of enhanced. Open just slow for me.
Good.
Okay. All right. So right now I'm focusing on the vermilion border, and this is going to give her some really pretty definition. So when she puts on a lipstick, she's going to see such a beautiful definition and a really good pop. As we age, we lose that rich border on the lip. They kind of sink in, so this helps to really give that structure. Just a little bit. Okay. So as you can see in that last picture, the treated side doesn't look crazy different. It's just a little more crisp, a little more full. A little more defined. Lip filler is one of my favorite things, and I do feel like there's a lot of misconception with it. People get a little nervous that they're gonna look. All finished, you did awesome. Like I was saying, lip filler, one of my favorite things to do. It can just add that perfect little pop to the lips. And it can be done and look totally natural. That's the best part about it. We have a lot of different fillers that we can use. So if you're somebody who wants it to be super natural, we can do that. We pick the filler that's appropriate for you. So anyways, post-care instructions, 24 hours, a lot of icing, just to keep swelling down. You can potentially get a little bit of bruising and swelling with this. It peaks over the first, swelling and bruising peaks over the first 48 hours, and then we'll kind of go back down to baseline. So you'll be sitting at your final result around 1 to 2 weeks. And then we'll have you normally come in for a follow-up and check everything out. So just ice up, drink a lot of water, and put on some lip gloss. I'm getting ready to draw a little bit of blood. We are getting ready to make PRP. So this is the platelet-rich plasma. This little test tube has a special auger, and it's gonna separate out the PRP from the rest of the blood. I'm gonna spin this test tube in a machine called a centrifuge, and then it will give us the platelet-rich plasma that's packed with growth factors, and we will infuse that during the microneedling. Okay, so I am using your PRP, and we are going to infuse this during the microneedling. So what we're going to see after the needling is goals are tighter pores, collagen stimulation, and just an overall skin rejuvenation. So this is an electronic pen, and there are little needles that oscillate at the bottom. And we're basically creating these little micro injuries, and how the skin responds is by repairing itself and building itself back up bigger, better, stronger. So this is called medical microneedling because it is done at a deeper depth. And so we are hitting the collagen layer, which is different from cosmetic needling, which is much more superficial and is not doing as much in terms of getting ready to do a little bit of IPL on Julie. That stands for intense pulse light or photofacial. This treatment is geared for hyperpigmentation. So the goal is to remove any sun damage. We are going to treat her shoulder and décolletage. So we are going to go over this area and fairly quick treatment. She's been numbing with topical numbing cream. We've already wiped that off. So the pulse light will travel through the skin, pick up on any sun damage, and pull it up towards the surface. So over the next week, her brown spots will become darker as they fall off. So IPL is great for all of the lighter skin types, and this is a great maintenance treatment to do just about once a year, just to pull up and pull out any sun damage that you may have. It also gives a really great collagen boost. Okay, so we're all finished. This redness is totally normal to be expected, and I'm just putting a nice cooling cream on, and that will cool the skin down. How do you feel right now, Julie?
Fine.
Yeah.
How was it?
It feels a little warm. It feels kind of like a sunburn, but it's nothing until